Synergy D6, the compact color key for top results. This refreshingly innovative nano composite is the true definition of aesthetic filling therapy. Advanced, simple, and efficient. Synergy D6 is based on a duo shade color system which can cover two Vita shades with one component. This technique makes it easier to manage the dental shade palette without the need to accept any loss of quality. Synergy D6 is a duo shade color system in which just 6 dentine shades and 2 enamel shades can be used for simple, safe filling therapy, which is also aesthetic due to the over-veneering of the shades. The initial situation reveals a disturbing picture in the anterior area with dental gaps and shade changes due to old fillings. We start with shade determination on the cleaned, still moist teeth. The Synergy D6 shade key is composed of original composite and allows a dentine core to be combined with an enamel sheath. A dentine shade is selected for the cervical area and an enamel shade for the incisal area. The overall picture of the shade match is compared with the combination of dentine and enamel shade tabs. The rubber dam is prepared for placement over the entire anterior area. The interdental rubber dividers are inserted with the aid of dental floss into the interdental space. The additional use of a dental ligature to press back the gingiva also helps. Preparation continues using 80 micron and 40 micron diamond drills. The dental hard tissue sparing preparation provides an optimal base for an aesthetic replacement. The interdental spaces are milled with a diamond-coated strip to create accessibility for the adhesion. To improve the result, you can etch the enamel in the anterior area with phosphoric acid, or you can apply the one-coat self-etching bond according to the manufacturer's instructions. Place model matrices in the interdental spaces prior to light curing to solidify the dentine bond. Use opaque dentine material for tooth extensions or tooth buildup. Include part of the enamel slope in the layering of the preparation margin. This creates an ideal base for subsequent contouring of the dental form by layering. The base is often created with a dentine material also in the cervical area when doing form corrections. And do not forget to contour the transition to blend in harmoniously with the natural tooth and prevent light transmission through the interdental space. Likewise, build up the teeth to their basic form with a bright dentine material. The individual increments are then light cured. For all teeth, always apply a darker dentine material in the central area for a natural-looking appearance. Select the layer thickness so that it retains the option for overlayering with an enamel material. For general brightening of the teeth, you may also at this point consider using the dentine white bleach. The material should be applied as uniformly as possible. To imitate the bluish translucent enamel edge, you can apply some enamel white opalescence. This material should be used only in the incisal area. Now you can contour the definitive form of the enamel edge and still leave space on the facial surface for further enamel layering. The layer thickness in the incisal area should correspond to the definitive volume of the enamel portion and extend about 1/3 of the crown length over the dental surface. This increment will also help shape the interincisal triangle and define the enamel edge direction. Finally, layer the restorations with enamel universal. This enamel material lends a depth effect to the tooth, provided that the layer is not too thick. This enamel layer should be spread as uniformly as possible with suitable tools. If the layering is satisfactory, you can now start applying structures to the tooth. Once you have applied the enamel material, you have also given the tooth its definitive form. The individual increments also should be light cured now, but you may prefer to fully cure all restorations at the end after completion of fabrication. Prior to applying the finishing touches, you should double-check for under-application of material and make any corrections necessary. Your finishing procedures should be performed with extra fine diamond drills at low speed and without water. Then silicone polish the surfaces and finally apply a high luster polish with a polishing brush. The margin should be checked again before removing the rubber dam. A further check after about 2 weeks is advisable. Synergy D6 can make shade and form corrections to the anterior teeth quite easy to perform. The chameleon effect of the dentine material, along with the depth effect produced by the enamel material, lends a really natural-looking appearance to the teeth. Synergy D6, the simplest possible filling therapy.